Hey people, it's Niles talking. Now, here's another story out. Two Alaska healthcare workers suffer reactions to COVID-19 vaccine. CNN, two workers at an Alaska hospital suffered allergic reactions after receiving Pfizer's COVID-19 vaccine this week, and one was kept for observation for at least 2 nights. Hospital representatives said the hospital worker's reaction was more serious but not life-threatening. Doctor said she felt flushed within the first 10 minutes of receiving the vaccine Tuesday at Bartlett Regional Hospital in Juneau, and later reported symptoms including shortness of breath and elevated heart rate. The second Bartlett healthcare worker was treated for less severe symptoms after being injected Wednesday, felt fine within an hour, and was released, hospital officials said. The case was the first allergic reaction to the vaccine to be widely reported in the U.S., although health officials say they're expecting the occasional allergic reaction and are prepared to treat anyone suffering from one. The two workers were among staff being vaccinated at Bartlett Regional Hospital as part of the rollout of Pfizer's vaccines across the country this week. State health officials reported the first one Wednesday, and the hospital publicized the second later in the day. We expected a side effect like this could occur after reports of anaphylaxis were made in England after people there received the Pfizer BioNTech COVID-19 vaccine, Alaska's chief medical officer Dr. Ann Zink said after the first reaction was reported. All sites that are approved to provide vaccinations in Alaska must have medications on hand to deal with allergic reaction, and that was the case in Juneau. Now, remember how they are using Newspeak and changing the language. We were told that they were completely safe and there was nothing wrong. Now they're saying that they're prepared for these things to happen and that they have medication on hand. Ooh, and remember, this is just immediately afterwards. There's no telling the long-term implications of this. The first staff member was admitted to the hospital. The first worker was initially held in the vaccine monitoring area right after receiving the shot Tuesday and took a Benadryl, said Dr. Lindy Jones, an attending physician at Bartlett Memorial Hospital. When she reported shortness of breath, she was taken to the emergency room. When Jones saw her in the hospital, he said she was experiencing shortness of breath and an elevated heart rate, and had developed a rash covering her face and torso. I was concerned about an anaphylactic reaction, so gave her the standard treatment of a dose of intramuscular epinephrine, and she responded immediately, Jones told a news briefing. She was also given antihistamines. She still had an elevated heart rate and was breathing fast, a sign of an allergic reaction. So Jones gave her another dose of epinephrine as well as steroids, which is another standard bread and butter treatment for adverse anaphylactic reactions. The worker, who was not further identified to protect her privacy, had no previous history of allergies to vaccines, Jones said. So, this is something quite anomalous to this vaccine. This isn't something standardized, oh, she was expecting this and was ready, or had any history of this. She was almost recovered after a night in the intensive care unit, Jones said. Later Wednesday, she still was recovering well, but would remain another night in the hospital, representatives there said. She was still enthusiastic that she got the vaccine and the benefits it would give her in the future. Jones said, "This is an instance where the system worked very well," Dr. Jay Butler of the U.S. Center for Disease Control and Prevention told the news briefing. Remember, people, Center for Disease Control and Prevention. It doesn't say elimination. Anyway, this reminds me of a scene from the book 1984 by George Orwell. And they say that they are at war with Eurasia. And midway through the speech, they say they are now at war with East Asia. And they get angry, not because they've been lied to, but because they got it wrong. That's what this woman reminds me of, saying that she's still enthusiastic after the vaccine gave her that reaction. The second worker experienced eye puffiness, lightheadedness, and scratchy throat 10 minutes after being injected with the vaccine Wednesday, the hospital said in a news release, whereas the first worker showed signs of a serious anaphylactic reaction. The second worker's reaction was not considered anaphylaxis. The hospital news release reads, the second worker was taken to the emergency department, administered epinephrine, Pepkid, and Benadryl. The release adds, he felt completely back to normal within an hour and was released. Like the first worker, the second does not want his experience to have a negative impact on his colleagues lining up for the vaccine. In other words, please do not let common sense and your own lived experience deter you from getting another shot. Because remember, they said that the shots, you have to take 2 of the shots. Both instances were reported to the CDC. Both instances were reported to CDC's Vaccine Adverse Event Report System, VAERS database. Bartlett Regional Hospital and State of Alaska Department of Health and Social Services are in close communication with CDC, and the agency is providing a guidance and support. The hospital statement reads, Dr. Paul Offit, a member of the U.S. Food and Drug Administration's Vaccine and Related Biological Products Advisory Committee, said on Wednesday that doctors will have to keep an eye out for allergic reactions to the new vaccine. It's the kind of thing that we're obviously going to need to look at, Offit told CNN's Brianna Kayla. He noted there were 2 reported cases of allergic reaction in Britain, which rolled out the vaccine earlier this month. There are obviously several people in the United Kingdom who had a severe allergic reaction to this vaccine and had a history of severe allergic reaction, said Offit, who is a director of the Vaccine Education Center and professor of pediatrics at Children's Hospital Philadelphia. I want you to pay attention to what they just said. They had a history of severe allergic reaction, and yet they still gave them the vaccines. It shows you how much they take their Hippocratic oath seriously. Do no harm. Oh well, let's keep going. Currently, the CDC recommendation is that if you have ever had a severe allergic reaction to an injectable medical product, you shouldn't get this vaccine, Offit added. So they're admitting that it isn't safe. We kept telling people that this was potentially dangerous, and they said, no, you're imagining it. So now they've admitted there is some groups of people who shouldn't take it. About 1 out of every million people who get a vaccine can have a severe allergic reaction to the vaccine. What we need to find out is what specifically seems to be inducing this allergic reaction. The FDA is working with Pfizer and the CDC to better understand what happened in Alaska. FDA spokeswoman said Wednesday after the first allergic reaction in Alaska was publicized. Importantly, the fact sheets to healthcare providers include language that severe allergic reactions have been reported following vaccination, and the appropriate medical treatment used to manage immediate allergic reaction must be immediately available for administration of any individual in the event of an acute anaphylactic reaction occurs, a spokeswoman told CNN. The Asthma Allergy Foundation of America also wrote on Wednesday that the FDA and CDC are all keeping an eye on reported adverse events. Recent media reports of reaction to the new Pfizer BioNTech COVID-19 vaccine, first out of the UK and now one report in the United States, are stirring safety concerns for people with a history of serious allergies. It's important to remember that we still don't have full details regarding the specifics of any of these reported reactions. Dr. Mitchell Grayson, chair of the Foundation's Medical Scientific Council, said in a written statement Wednesday before the second Alaskan case was publicized. We're in the early stages of the COVID-19 vaccine. It's common to see adverse vaccine reactions once wider distribution to the general public begins, even if none of those reactions were observed in clinical trials. Well, of course they couldn't have noticed. They took less than a year to do it. I've said this before, although I don't like or trust vaccines, a normal vaccine trial, development takes 5 years. This took less than 1. Additional vaccines are in the pipeline, so there will be likely more options if it is determined that one vaccine works better in certain populations than others. It's important to let the science do its work, not the headlines. Anyone with concerns about allergy risk should consult with their doctor. Well, I hope you've enjoyed this. Please comment, rate, share, and subscribe. If you want to support this channel, I'll leave my GoFundMe in the description. If you'd like to follow me on Instagram, I'll leave it there as well. If you want to check out all my t-shirts, you can check that out as well. Peace.